I'm Dr. Wendy Askew, and I work for the Institute for Women's Health. I'm a board-certified obstetrician gynecologist, and I'm also board-certified in functional medicine. Sonetics Clinical Laser Hair Therapy is a treatment that utilizes low-level laser light that's been studied and shown to be very effective in restoring hair growth for patients who are suffering from thinning hair and hair loss. The Sonetics device works through the utilization of a spectrum of light in the red wavelength that's been studied and shown to help improve a number of features that promote health and repair of the hair follicles. It allows blood vessels to regrow to the hair follicles, which allows nutrients to be supplied to the hair follicles, which are the organs that grow hair, of course. It enables them to take up their nutrients, their oxygen, their glucose, the vitamins that they need in order to build hair. It also is very important in helping the cells to eliminate a very harmful byproduct called dihydrotestosterone that is directly toxic to hair follicles. And when the cells can remove this harmful toxin from themselves and are able to get the nutrients that they need, they're able to begin growing new hair. First, what we typically see is that they stop shedding. And then in another 1 to 2 months, they'll start to see new hair growth. Over time, what patients see is restoration, regrowth of hair in the thinning areas. They don't see patches of scalp on their head anymore, and the hair that they grow tends to be thicker, stronger, and less prone to breakage. Most patients who are suffering from hair thinning and loss would be good candidates. There are a few groups of people who we would need to see first, who might need an exam or who should be excluded, but some of the patients who are excellent candidates are for men and women who are suffering from diffuse thinning, patients who are losing hair following a stressful event in their life, be it a surgery or an illness or a delivery of a child, patients who are suffering from thinning hair as a function of genetics. Maybe all their family members had thinning hair, and so they've noticed it and just felt that that was their fate. They were resigned to it. Women who are suffering from hair loss as a result of hormone changes that they experience when they go through menopause or even perimenopause. And men and women who can't or don't want to use products like Rogaine or can't afford or don't want to undergo hair transplant surgery. Patients who've gone through chemotherapy and lost their hair from their cancer treatments and won their battles against cancer are excellent candidates as well. Treatment with the Sonetics Clinical Laser Hair Therapy is completely painless. It involves patients coming into our office, typically 2 times a week for 3 months, and then shorter durations, once a week for 3 months, and then every other week. It's a 1-year course of therapy, and when patients are in receiving the treatment, they simply sit in our comfortable recliner chair. They can watch television or work on their computers, and the light, we lower the cap down over their head so that the full scalp is exposed. There's no warmth, there's no discomfort, there's no itching, there's no sensation at all. It's extremely safe. We don't require use of eye protection, and they just sit and rest for 20 or 30 minutes while the light does its job. Our phone number at that office is 210-494-2000, and our website address is www.ifwh.org.